Across Native North America, there is beauty, strength, and resilience in our nations and across our sacred homelands. However, our communities still face critical issues that we struggle to address. One of those issues is the loss of our people to suicide. The suicide death rates for Native American and Alaska Natives are presently 4 times that of the general population. Indigenous children are more likely to end their lives by suicide than any other group of young people. The Zero Suicide Initiative is a federal program funded by IHS with an aim at promoting life by reducing the number of suicide deaths in Native America. The initiative has witnessed many examples of excellence in the implementation of Zero Suicide since the first Native-focused Zero Suicide Academy several years ago. Under the guidance of IHS's national lead for the Zero Suicide Initiative, and with collaboration and technical support provided by the tribal lead for the Zero Suicide Institute at EDC, grant awardees have worked diligently to ensure the implementation of suicide-safer care using the Zero Suicide model. We're here at Tsehootsooi Medical Center in the heart of the Diné Nation in Fort Defiance, Arizona, with Dr. Heather Ann Indelicado and the staff who are implementing Zero Suicide in an effort to stem the tide of suicide-related deaths in Native America. Tsehootsooi Medical Center and its satellite clinic have distinguished themselves as a system that has united Western medicine with the traditional medicine of the Diné people. Working as a specialty clinic under medicine, the traditional medicine clinic with its traditional healers work hand in hand with those who provide Western medicine to ensure people receive care that is culturally resonant with them and their healing ways.
My name is Dr. Heather Ann Indelicado. I'm the Zero Suicide Program Coordinator for Tsehootsooi Medical Center in Fort Defiance, Arizona. I am a clinical psychologist and suicidologist. Our healthcare facility is located in Fort Defiance, Arizona, about 10 minutes from the Navajo Nation's capital. This is a very sacred place. We also have a clinic located in Sanders, Arizona. It's about an hour from here. Prior to the Zero Suicide Initiative, there were some early interventions. One of the interventions was a meth suicide prevention grant. There is a traditional healing program. There is an adolescent care unit. We also partner with Navajo Nation Suicide Prevention Program. We implemented the Zero Suicide model, introducing it to a small but passionate group of clinicians from each department, community members, and all healthcare providers. So from the very beginning, my team consulted with the Traditional Service Department, specifically their supervisor, Mr. John Tsehootsooi. What ended up happening is we had a lot of teaching and sharing times with each other.
Yat she John Tsehootsooi initiated the night Hachin initiative. In translation, the White Mountain Band of Red Running into the Water is my maternal clan. My paternal clan is the Tangle people, and then my maternal grandfather is from the Tarwin House. My paternal grandfather is from the Big Water clan, and I'm from a place called White Clay, Gleshlake, and I'm the lead traditional healer counselor for Tsehootsooi Medical Center. We consist of a staff of 4, and able to use our knowledge of our own, what we learn. We do have an herbalist, we do have a traditional medicine man, we do have a NAC roadman. We do work within the confines of those traditional medicine. So here in the hospital, the same thing that we do. A lot of our traditional ways, traditional methods, our ceremonial items, our paraphernalia that we utilize, our prayers, our songs that we utilize to bring the patient back into focus, to realign themselves with Mother Earth, Father Sky, to their four beings, your physical, mental, your emotional, your spiritual, able to reconnect with them. And that's how we do with that traditional medicine. We know ceremonies that we do, but it begins with understanding the person that we're working with, a little background. Like I said, from a certain point, saying yate, making that connection with the individual, that's the first and foremost. As simple as this talking, that can become medicine. Words becomes our medicine.
They've been integral in getting this model rolled out, the messaging, buy-in, and they consult to us a lot, explaining things and making sure we're on track with cultural appropriateness and sensitivity. I think including community partners has been very important. There's also a crisis response team, and they're stationed in different parts of the reservation. The nurses are the ones that have gotten the templates in to our electronic health records. Also, working with a local epidemiologist is critical. That information was very important when building this program, to know what our baseline is in the community. Another challenge is being prepared for the assumptions that others have, because there tends to be this belief that, well, it's a program about suicide, so it's always going to be doom and gloom. But we work together to frame that through the lens of hope and resiliency. For us, we're in a very remote, rural area. Not all tribes are, but ours tends to have a lot of challenges around people getting to their appointments, transportation, and whether insurance can help them with that or not. People living remotely are hard to reach sometimes, and so the transitions and the offerings that we have at our facility include a public health nursing department. So often they're sent out if we don't see a patient after he or she has been assessed for suicidality in the ER. We also have a mobile health clinic. The mobile health clinic provides services in the community 2 or 3 times a week. We have a social worker that is trained to complete evidence-based screening and assessment on the mobile health unit, and we are discussing in both facilities the use of teleservices. Finally, engaging peers and persons with lived experiences in our program has been so important. We need their perspectives. Some of our successes would be the collaboration with our traditional service unit.
Yate she ya Aaron Salmonsha. My deskizin she todich ini na kadne dashichi. Ado akodo na shatso de. Adon daeya hazel in banashish. To Tsehootsooi has anigi kwa hazel in. I've been working here for Tsehootsooi Medical Center for over 9 years. And I've been working with the overall hospital, inpatient, outpatient, OB ward, MSU, ICU, as well as the PEDS clinic as well, adult clinic, PCC. And I've been utilizing my traditional interventions, my spirituality on Nabuhu, the Nabikeya, for over 13 years that I've been doing all-night ceremonies. 20 years plus in the diagnostician field. That not just only we're not providing only traditional interventions, but knowing that we're here to educate and to educate our people and educate the surrounding elders, or even as young as young children that can come by and learn how to pray, to come by to ask questions. So Tsehootsooi Medical Center provides that type of service that we can do one-on-one contact, one-on-one interventions, bedsides as well as Hogan. It's an octagon healing place where it's known here on the Ne people, the Ne land, that these hogans are a way of life as well as healing. So we do have that here on site at Tsehootsooi Medical Center.
In order to provide suicide-safer care in Native America, we need to honor the cultural norms, approaching the community in a way that is respectful and that acknowledges their unique perspectives, ways to address the particular topic of suicide. Really handling the language with care and concern.
How do we say that? Suicide. So the term azetneta, able to, they're contemplating, okay, and when they completed that death happened. The harsh side of it, that's what we don't want to say to people. People say, don't say that, don't talk about it. And the reason behind that is, when you talk about that, you don't want that to become a part of you where it affects your mind. And that's the reason why our elders tell us, don't talk about it, don't say that. Shh, don't you need that? That's what they tell us. But here in the hospital, we do talk about it, and I do say, let's talk about it, because it's going to help our children, it's going to help our relatives to understand this suicide.
Some policies around our Zero Suicide initiative that are in place right now include an emergency department companion policy, someone that can sit with that patient that has reported suicidal ideations. We also have a safe room. Something else that has started is a hospital-wide screening and assessment policy. Some other efforts are departmental training components, for example, evidence-based counseling for access to lethal means. And they've also been trained on the Stanley Brown suicide safety plan. So every patient that doesn't get sent out, that is seen in the ER for any kind of suicide, we give them a safety plan. We complete it with them. We are planning how we will more effectively track our screenings and make those screenings and our results congruent with specific diagnostic codes. Determining if an individual coming in for services, if they practice traditional medicine or use traditional healers or not, can be as simple as just asking them. Some patients start talking about it, and maybe they don't realize that we have traditional healers, and then they request a referral. Some departments literally use a checkbox on their initial intake. The hogan that is utilized by the traditional healers is often used for treatment. So with the adolescent care unit, it is part of their program or their package of treatment. And they have sweat lodges, they have weaving and loom, and a lot of other specifically traditional types of treatments, modalities.
I work with adolescent care unit, 13 to 17-year-old. So they're inpatient, so we do work with them. They have their therapist, they have a psychiatrist, they have a psychologist, and with traditional medicine, we're right alongside that just as well, working with them. As traditional medicine is just as effective as Western medicine.
Some things that are most valuable have really been the community relationships, partnerships with leaders, including the ER and behavioral health people who tend to see people in crisis, staff who are devoted to the prevention of suicide or have been touched by suicide. I think something else that's been invaluable is using visual aids or tools when we're teaching and presenting to various departments. So everyone is very diverse here and they take in information differently. Community outreach programs get highlighted on a local radio station. Our team created a risk and resource card, and people in different departments request that card a lot to give to their patients. In collaboration with the traditional service team, our ZSI program has started a postvention talking circle.
On a month-to-month basis, we provide talking circles for Tsehootsooi Medical Center staff, providers, as well as in the near future, we're going to open up to the community. And a lot of times that we provide these talking circles is for more an expression, however way that they're affected by suicidal ideation of a family member. A lot of them, they kind of keep it within themselves. So these opening circles that we talk about, these talking circles, actually, it brings a warm welcome to them, where they feel that, that they're not alone, where they're actually sitting amongst other individuals that are affected, family members that are affected, and as well as staff that go through trauma with their patients that went through suicidal ideation.
Collaborating with Indian Health Services, the lead for the national program, and collaborating with the Zero Suicide program. Those programs have been extremely valuable and necessary for our program to continue.
The team at the Tsehootsooi Medical Center and its satellite clinic in Sanders, Arizona, served the Dene people as an example of a system that has united Western medicine with the traditional medicine of the people to ensure that the care provided to them is resonant with their healing ways. They have embraced the idea that safer suicide care is not just the responsibility of the behavioral health staff, but that it's the responsibility of every single member of their staff, regardless of their position in the system. They have been able to change the culture of the organization, ensuring the sustainability of zero suicide as a way they deliver care, making it safer for tribal members, their families, and their communities. For more information on implementing zero suicide in Native America, please visit zerosuicide.com or visit ihs.gov under the Zero Suicide Initiative tab.